My name is Dr. Michael McKindley from Progressive Physical Therapy and Rehabilitation. One of the most common things that people complain about when they come into physical therapy or into their doctor's visit is low back pain. Now, low back pain can manifest itself from joints in the back, from muscles in the back, or from the disc itself. But when conventional physical therapy, cortisone injections, or medications do not resolve the low back pain, what could possibly be the problem is below, and this area of the pelvis is called the sacroiliac joint. The sacroiliac joint is your pelvis, and it's made up of three bones. Our tailbone, which medically we call our sacrum, the hip bone, which we medically call our ilium, and we have one on each side. The ilium is also the socket to our ball and socket of our hip joint. So we have our sacrum meeting our ilium, in the low back we have our SI or sacroiliac joint. Why is this a frequent cause of low back pain? Well, the sacroiliac joint is built like no other joint in the human body. If we take a joint and we think about it, there should be two smooth surfaces of bones moving in a friction-free environment, like your elbow. The sacroiliac joint is not built like that at all. The sacrum itself is actually rigid, and the ilium is rigid, and they fit together like a tight puzzle piece, not designed to move, ever, except when women give birth. This is the hinge to the birth canal. Now, because of that, this problem is more common in women, but also common in men. When this joint is to move, what will happen is the ilium will move up onto the sacrum. And when it moves up, the teeth will reset and the hip will remain high. When it moves up, it can also rotate. So, for instance, in this model, the left could move up and rotate forward. As this rotates forward, your right will automatically rotate backward, causing both sides to be affected. Now, when that happens, you can see by the model that there will actually be a shift or excessive pressure applied or jamming of the joints together on one side. Now, that can manifest itself as low back pain. Patients that go through conventional physical therapy, facet injections, cortisone injections, epidurals, oral medication that don't see any relief, the reason for that is that they're continuing to stand or sit in a position that's putting excessive stress on the joints. That's when we need to look at the pelvic joint below. Another common cause of what SI can do is hip problems. So patients that have hip stiffness, hip pain, maybe even a clicking or a snapping sensation in the hip that does not seem to resolve. Again, cortisone injections, physical therapy, medication, hip is not getting any better. What can happen is the ilium or the eye can rotate, changing the congruency of the socket, and that can create symptoms in the hip. When we look at a sacroiliac joint, we're looking to see where it is in space, on whether it is in neutral or elevated. This is the most commonly misdiagnosed problem that we see. Most physicians are not looking for this problem. Why? Because this joint is so stable, it's assumed it's not moving anywhere, and it's most commonly missed on an X-ray or an MRI, even if you've had an X-ray or an MRI of your pelvis. So just be leery of that. Just because you had an X-ray of your pelvis does not mean it is not shifted. Ask your physician to look. Ask for your physical therapist to look. Not all physical therapists know how to treat it or what to look for. So if your physical therapist that you're seeing now is not aware or know how to treat your sacroiliac dysfunction, feel free to give us a call. Once this is corrected, the pelvis can go back into a neutral position, and it's treated quite easily and really without any pain. If you imagine it's shifted up, creating excessive stress onto the joint, onto the spine, when rotated back into a flat neutral position, the stress is taken away, and thus your symptoms can be reduced. Same happens with the hip. When the ilium is rotated, the congruency or normal position of the hip is restored, so your range of motion or snapping or those type of symptoms can be reduced. This is commonly misdiagnosed. I just want to make sure we cover that again. So if you have any questions, or if you've had low back therapy or hip therapy that is not resolved, give us a call and we can take a look. We are here to help. To learn more